Misconceptions and Stereotypes about Borderline Personality Disorder, BPD, Importance of Treatment Based on Understanding, Not Judgment. Borderline Personality Disorder, BPD, is one of the most stigmatized mental health conditions, and the misconceptions and stereotypes surrounding it often lead to significant barriers in the diagnosis and treatment of the disorder. Individuals with BPD are frequently misunderstood, and their symptoms are often misinterpreted as manipulative, dramatic, or attention-seeking. These judgments can severely affect the way people with BPD are treated in both personal relationships and therapeutic settings, contributing to further emotional distress and social isolation. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the importance of treatment based on understanding, not judgment. We will discuss how stereotypes and misconceptions can negatively impact the treatment and support of individuals with BPD, and how a more compassionate, informed approach is key to effective care and emotional healing. 1. The danger of judgment and treatment for BPD. When individuals with BPD are judged based on harmful stereotypes, such as being manipulative, unstable, or attention-seeking, it can prevent them from seeking help, or lead to them being treated as difficult or untreatable patients by clinicians. This judgmental mindset can be a significant obstacle to effective treatment and healing. 1.1 Why judgment harms the treatment process. Judgmental attitudes, whether from loved ones, therapists, or society, can severely hinder an individual's willingness to engage in treatment or therapy. When individuals with BPD are met with disdain or dismissiveness, they may feel like their struggles are invalid or that they are being treated unfairly, which can reinforce feelings of shame and hopelessness. Key fact: BPD is a mental health disorder characterized by emotional instability, fear of abandonment, and a fragile sense of self. These symptoms are not intentional behaviors or attempts to manipulate others. Judging these symptoms as deliberate or malicious perpetuates misunderstanding and harms the therapeutic relationship. 1.2 The consequences of judgment in therapy. A therapist who views their patient through a judgmental lens may misinterpret the individual's behavior, focusing on perceived flaws rather than understanding the underlying emotional distress. This can result in ineffective treatment or the patient being labeled as difficult or non-compliant. Key fact: in therapy for BPD, emotional validation and a non-judgmental approach are critical. When a therapist listens without criticism and shows empathy for the individual's emotional struggles, it creates a foundation for trust and healing. 2. The importance of understanding BPD's roots. BPD is rooted in deep emotional pain and dysregulation, which often stems from a combination of genetic predisposition, neurobiological factors, and early trauma. When BPD is misunderstood as a character flaw or the result of poor upbringing, it ignores the complexity of the disorder and the validity of the person's emotional experience. 2.1 Understanding the emotional pain behind BPD. People with BPD often experience a profound fear of abandonment, chronic feelings of emptiness, and difficulty in regulating emotions. These struggles are not the result of being manipulative or difficult, but rather are a reflection of the deep internal conflict caused by intense emotional vulnerability. Key fact: people with BPD are not intentionally trying to manipulate or upset others. Their behaviors are often coping mechanisms developed to deal with overwhelming emotional pain, abandonment anxiety, and feelings of unworthiness. Treatment should focus on understanding these needs rather than judging the behavior. 2.2 The role of trauma in BPD. Many individuals with BPD have experienced early childhood trauma, such as abuse, neglect, or emotional invalidation. These experiences contribute to the emotional dysregulation and relationship instability seen in BPD. Failing to acknowledge the role of trauma in BPD leads to an incomplete understanding of the disorder, which can hinder the healing process. Key fact: trauma-informed care is essential for individuals with BPD. A therapist or clinician who recognizes the impact of past trauma can offer a more empathetic and effective treatment approach. This focus on trauma helps individuals with BPD heal their emotional wounds and learn healthier coping strategies. 3. The benefits of non-judgmental treatment. To effectively treat BPD, it is essential that the approach be based on understanding rather than judgment. Non-judgmental treatment encourages individuals with BPD to open up, trust their therapist, and engage in the healing process. This approach also helps to reduce shame, a significant barrier to treatment, and fosters a sense of hope for recovery. 3.1 Creating a safe therapeutic space. A safe, non-judgmental environment allows individuals with BPD to feel validated and supported, which is key to addressing the root causes of their emotional struggles. Therapy for BPD, such as dialectical behavior therapy, DBT, focuses on accepting the individual's emotional experience while helping them develop new skills for regulating emotions and improving relationships. Key fact: the therapeutic relationship must be based on trust, empathy, and understanding. When therapists approach BPD with an open mind, free of judgment, individuals with the disorder are more likely to feel safe and valued, which enhances the likelihood of successful treatment. 3.2 Enhancing self-esteem and self-compassion. Non-judgmental treatment helps individuals with BPD develop self-compassion and self-esteem, which are often impaired by years of negative self-beliefs and emotional instability. By focusing on self-acceptance and helping individuals recognize their worth beyond their behaviors, therapists can empower patients to take control of their emotional experiences and build healthier relationships with themselves and others. Key fact: self-compassion is a cornerstone of recovery for individuals with BPD. Treatment that is rooted in understanding rather than judgment fosters a sense of self-worth, helping individuals with BPD feel more empowered and capable of positive change. 4. The role of loved ones in supporting BPD treatment. Family members and friends also play a critical role in the treatment of BPD. When loved ones label individuals with BPD as manipulative or unstable, it can create a toxic dynamic and further reinforce negative behaviors. On the other hand, when loved ones offer support, understanding, and validation, they can help foster an environment of healing. 4.1 Setting healthy boundaries with compassion. While setting boundaries is important in any relationship, those with BPD often struggle with boundary issues due to emotional intensity. It is crucial that boundaries are set with compassion and clarity, without resorting to labels or judgment. By setting healthy, firm boundaries while offering emotional validation, loved ones can help those with BPD manage their emotions in a more positive way. Key fact: people with BPD can thrive in relationships when boundaries are clear, but also when there is a foundation of empathy. Loved ones who recognize the emotional pain behind BPD behaviors, rather than labeling them as manipulative or unstable, can support the individual in managing their emotions and reducing emotional volatility. 4.2 Encouraging treatment and self-care. Support from loved ones is vital in encouraging individuals with BPD to seek professional treatment and engage in self-care. By offering encouragement, validation, and understanding, loved ones can help reduce feelings of shame and motivate individuals with BPD to take positive steps toward recovery. Key fact: support networks are essential for recovery. By encouraging therapy, DBT, and self-care practices, loved ones can play an important role in the healing process for individuals with BPD. 5. Conclusion. The stereotypes that label individuals with borderline personality disorder, BPD, as manipulative or unstable not only harm the perception of those with the disorder but also create barriers to effective treatment. These labels contribute to shame, misunderstanding, and fear, preventing individuals with BPD from receiving the care and compassion they need. Treatment based on understanding, empathy, and non-judgment is essential for helping individuals with BPD manage their emotions, heal from past trauma, and build healthier relationships. Through compassionate care, both from therapists and loved ones, individuals with BPD can learn to regulate emotions, improve relationships, and ultimately lead more fulfilling lives. Moving beyond judgment and focusing on understanding will not only improve treatment outcomes but also create a more supportive and compassionate environment for those living with BPD. In future episodes, we will continue to explore the importance of understanding BPD in the therapeutic process and how to reduce stigma by promoting compassionate care. Stay tuned for more insights on borderline personality disorder, BPD, and the path to recovery.